Police departments across BC will soon have a new tool for mental health or addiction-related calls.
When people in distress reach out for help, we need to take the right steps to make sure they're safe and connected to the care that they need. On
Wednesday, BC's Public Safety Minister announced $2 million in funding for the BC Association of Chiefs of Police to roll out Health IM, a software that's meant to help frontline police officers de-escalate crisis situations.
1 in 5 interactions with police in British Columbia involve an individual who is experiencing a mental health concern, who is in a mental health distress.
Health IM gives officers available information about a person in crisis before they make contact. It also helps officers assess the person through a questionnaire, and it sends information to healthcare providers so they're prepared if the person is brought to a healthcare facility. Other provinces and some BC police agencies use the software, including the Delta Police Department, which implemented it in 2019.
You open the platform, if you type the name in, you can search to see if the person is already being assessed in the past. If they have, there's going to be certain information that will be very apparent to the officer right at the onset. Some trigger information, some de-escalation advice. And this is information that's entered by the officer in the previous assessment.
Health IM was launched in Ontario about 10 years ago. The company's president says the software reduces the amount of time officers spend in hospitals.
Typically, we do see a reduction in the wait times of around 15 to 20% off the get-go, just in helping to share that information faster to the hospital site, helping to improve the quality of communication, and also assisting the officers in sort of getting that person the help that they need sooner.
The province says the software also sees more people taken into hospital instead of custody. One mental health organization welcomes the tool if it's paired with good mental health training, so officers understand the information it gives them.
Having been trained in both what mental illness is and what distress is and signs and symptoms is really key to avoid unconscious or conscious stigma.
The program's province-wide launch begins with the Port Moody Police Department, which will start using it on Thursday.
The plan is to roll it out through this year and have it completed across British Columbia by the end of next year.
In Port Moody, Monika Gul, City News.